Good evening, everyone, and welcome to Exploring the Brain. I'm Dr. Brad Schlager, pediatric neurologist and president and CEO of Kennedy Krieger Institute and professor of neurology and pediatrics at the Johns Hopkins University School of Medicine. At Kennedy Krieger, I have the privilege of leading a team of more than 3,200 dedicated, mission-driven staff members who, together, make it possible to provide care and education for nearly 30,000 unique patients and students every year. Because this might be the first introduction to Kennedy Krieger for some of you, let me provide a bit of background information about our nonprofit organization. So we're nearly 90 years old now, based in Maryland, with our primary campus in Baltimore, but with over a dozen sites located throughout central and southern Maryland. And while we may be best known for our clinical services and research, we also have 5 schools that serve publicly funded students who are referred to us by local public school systems from throughout Maryland and DC when that local school system determines that the student's educational needs cannot be fully met. So as an organization, we understand that for children and teens, especially those with disorders and disabilities related to the developing nervous system, clinical care and education are inextricably connected. So now onto tonight's webinar topic. Raising a child with one or more disabilities is a journey filled with love, resilience, and hope, but it also comes with complex challenges that at times can feel overwhelming. Families often find themselves navigating unfamiliar systems, searching for answers, and struggling to access the support and resources their children need and deserve. The path can be isolating, confusing, and frankly, exhausting. Too often, caregivers are left to piece together information from multiple sources, advocate fiercely for services, and then make critical decisions without a clear roadmap. But families shouldn't have to do this alone. And that's why this evening's webinar, introducing the Maryland Guide for Families of Children with Disabilities, is so important. This brand new guide is a comprehensive resource developed by Kennedy Krieger Institute with support from the Maryland Department of Health's Behavioral Health Administration. This guide was created to empower families, to help them find clarity, connection, and confidence as they care for their children. So whether you're a parent, professional, or advocate, your presence here tonight reflects a shared commitment to making Maryland a place where every child with a disability and every family can thrive. So this evening, let's explore together how this guide can be a lifeline for those who need it most. And we have an expert panel here with us tonight to discuss this important topic. But first, a few housekeeping notes. Your video and audio will be muted during the webinar, so please use the Q&A feature if you have any questions. The Q&A feature is likely located at the top of your Zoom window, but it could be in different places depending on your system. So find it and you can click and then submit a question. We'll try to get to all the questions during the Q&A period at the end of this panel discussion. The webinar is being recorded, but your identity won't be shown on the screen, nor will we identify who it is who's asking the questions in the Q&A period. And the planned panel discussion will be about 50 minutes, give or take, with 20 minutes of question and discussion at the end. So now I'm very pleased to introduce our expert panel, 3 of my extraordinary colleagues at Kennedy Krieger who are the content editors of the guide. They are Dr. Mary Leppert, a neurodevelopmental pediatrician in the Department of Neurology and Developmental Medicine at Kennedy Krieger Institute, where she is, among many other roles, the chief editor of the Kennedy Krieger Instruction in Neurodevelopmental Disorders curriculum, the KIND curriculum. And Dr. Leppert is an associate professor of pediatrics at the Johns Hopkins University School of Medicine. Dr. Mia Asato is a pediatric neurologist who serves as the vice president of training at Kennedy Krieger. Dr. Asato holds the Arnold J. Caputi Endowed Chair in Neurodevelopmental Disabilities, and she is an associate professor of neurology at the Johns Hopkins University School of Medicine. And Maureen Van Stone Esquire is an attorney specializing in special education law. She's an assistant vice president and director of the Maryland Center for Developmental Disabilities at Kennedy Krieger. We also call it the MCED, and is founder of Project HEAL, that's Health, Education, Advocacy, and Law, which is a medical legal partnership. She also has a faculty appointment at the Johns Hopkins University Bloomberg School of Public Health. So welcome, Mary, Mia, and Maureen, and let's get started. So Mary, let's begin with you. Let's talk about how healthcare providers, how teachers, and other professionals can support families.
Thank you, Brad. Brad, I've been really fortunate to have spent my whole career here at Kennedy Krieger Institute and been surrounded by those 3,200 now, I guess, mission-driven physicians and educators and nurses and special ed law and disability attorneys, where there's this sort of constant exchange of information and learning and updating of information that keep us all, I think, ready and able to support our families. But I've had the real privilege in the last 10 years of working collaboratively with community professionals through Project ECHO. And what we've learned that these professionals are always seeking information about how to help children and families of children with disabilities navigate some of the systems you spoke about, the healthcare and education, legal systems. And across these years of the training, my ECHO team kept saying to me, we should figure out how to make this information accessible directly to the families. And fortunately, Maryland Behavioral Health Administration agreed with the idea and have supported us in making this guide. And just for some context, the guide is an online resource that covers the lifespan approach from early diagnosis of developmental disabilities or disorders through adulthood.
So Mary, real quick, you mentioned Project ECHO. Just maybe say a thing or two about what ECHO is.
So Project ECHO is it stands for Extension for Community Healthcare Outcomes, and it is a hub and spoke sort of model of people here at the Institute who connect on a regular basis with community providers to help with case consultation and to give some didactic instruction for learning how to care for children in their medical home or in their educational home.
Yeah, it's a really powerful mechanism for dissemination of expertise, and you have been a champion of that approach. So let's singing with you. What are some of the most common challenges that families face when raising a child with a disability?
I think that the challenges are numerous. We all know the beauty and the benefits are numerous as well. But what we have is like some clear evidence of the questions that were asked most frequently, and those questions tend to surround how to access or navigate healthcare and mental health systems, and how to access or optimize services through the school system, particularly in under-resourced areas of the state. But I think that some of the things we were really trying to address here is the challenges that families don't bring up in clinical conversations, but are really important ones to have access to information about in advance in particular. And these are things like, how to navigate social situations and family difficulties when they're raising children with disabilities, and how to prepare for legal and financial needs of children as they transition from school to adulthood.
So, I mean, we're here in Maryland, and we've been talking about the Maryland Guide, but are these challenges specific to Marylanders, or are they similar across the states?
By no means are these challenges specific to Maryland. One of our echoes sort of covers a big part of the country, and we're hearing the same things across the land, right? So these challenges really are the same for children across the country. The guide that we've set up is called the Maryland Guide because although much of it would be important for anybody in the country to access, some of it is really specific to the regulations or the laws within Maryland. Those are the educational and some of the legal modules.
Maureen, turning to you, Let's talk about how these challenges differ across communities, especially in Mary referenced underserved or rural areas. And along those lines, why is it so difficult for families to find and access the right services at the right time for their child?
Thanks, Brad. Yeah, there can be delays in the identification of a child with a disability, especially in certain cultural groups around the state of Maryland. And in some areas, we really find a lack of community-based providers. The family may struggle to find service providers in the community who might be the first person to identify the child as suspected of having a disability. There are also a limited number of advocates and attorneys representing children with disabilities and their families, especially in rural parts of our states. So there are 108,000 children with disabilities who are identified in Maryland, and there are about 35 attorneys who work in this space. So the need far outweighs the capacity of our bar. There are also, in some districts, there is not a full continuum of educational placements for children with disabilities, and there are limited resources to help families engage in effective transition planning. For example, in some parts of their state, there is no access to public transportation, which makes it difficult for transition age students with disabilities to access job or career exploration programs. So in some of these situations, it's the geography of where the child and family lives, and in some, it's the lack of providers in the area.
So Mia, building on Maureen's comments, addressing some of the barriers, what are some of the additional barriers, emotional, logistical, systemic, that can prevent families from getting access to the help they need?
Thanks, Brad. Families have limited resources, and particularly in the time and energy departments, when someone is very occupied with day to day needs, parenting, juggling other roles, even if you were to find a resource, can you really trust it? The education and social systems can be particularly tricky to navigate, and wading through technical terms and qualifiers online can take a lot of energy. And if you were to check out a resource and reach a dead end, it can be very disappointing and can take an emotional toll on families. So families may hesitate before they actually go about exploring some of these resources.
Well, how would you say that professionals can better support families, understanding, navigating complex and often siloed systems like education and healthcare, and including behavioral health?
Sure. So we welcome many professionals at Kennedy Krieger to receive specialized training, and it's an important part of our training to teach professionals about the resources that can help families thrive. And it is our hope that professionals will use these video modules to gain a more complete understanding of what families may need at different stages of their child's life. I kind of conceptualize this as developing a professional Rolodex of helpful information for families. I know Rolodexes are outdated, but it really calls to mind the importance of having these ready resources and conceptual knowledge to provide information when it's needed.
So, Mary, we've heard a little bit about some elements of the composition of the guide with some video modules. It addresses a number of different topic areas, but let's maybe a little bit more about the structure of the guide, and then how do you see the guide addressing the challenges that we've just been describing?
Okay, thanks, Brad. I I keep thinking guide sounds like a handbook, right? It really isn't a handbook. It's a series of like 15-minute video modules that really highlight the experts across the Institute with their experience on topics that address these anticipated challenges for families. The guide is, as all of our curriculum, laid out into sections, and there are 5 sections in this course, if you will, this guide, that include healthcare considerations. And that goes from diagnosis to healthcare maintenance. Um, e- and the next one is education. So we talk about like identifying and receiving services, but there are also things like, how to manage bullying or being bullied or things like that in the school system. We have the third section is on family considerations. And I would say with all 5 sections, we have parent interviews, so parents that really talk about, what the impact was on them that really led some of the work we did. We have sibling interviews in the family life section as well. The fourth section talks about transitioning children from the educational to the adult systems of care and the legal considerations that go with that. And then the final section is really on what are those adult systems of care and how do you really get involved with them and how do you know whether to what to trust and where to look. So the guide, each of these sections may have 5, 6, 7 little separate modules in it. And what I think is really important is that, when people come to clinic, right, we think about the age of the child we're seeing and we anticipate what kind of anticipatory guidance they may need. But sometimes families aren't ready. Sometimes it's not at the right time. Sometimes it's not germane to the family right then. And what's nice about this guide is that families can go to it just in time, as you will. When they need the information is there. Well, we know, right, from evidence, right, from the data from national surveys of health of children, and we know from our own experience that the families of children with developmental disabilities or disorders are both resilient and generally coping well, but they are their children's expert and they are their children's advocate. They know what they need, but they don't often, as we've heard, know where to find it. And they don't always know what to trust when they do find things. So the guide really places practical information into the hands of families that we hope alleviate some of the burden of looking for the information.
So Maureen, in your house at the MSED, there's a focus on the resource finder, for example, for Kennedy Krieger Institute, which is this immense, comprehensive set of resources constantly being updated. So it's a significant resource collection of resources. So how would you describe how this guide is different from other, even rich, robust resources like the Resource Finder that are currently available to families?
I think one of the things that makes this attractive is that families, as Mary mentioned, can pick and choose which video modules they want to watch in any order. And some may be relevant and some may not. And so I think that's really a nice aspect where they have the ability to choose what is relevant at that moment in time for their family. I also think we do a deep dive into substantive legal topics, which is not always available to families, particularly in those underserved parts of the state. So we have several attorneys across the Maryland Center for Developmental Disabilities and specifically Project HEAL who have contributed to this guide in a really meaningful way. And so it's receiving access to advocacy and legal resources in 20 minutes or less, and on very substantive legal topics. So I think that really helps set this guide apart from other resources that exist in the community. And then we did work with the Resource Finder, as you mentioned, to develop a comprehensive resource repository, which is at the end of the guide. And this is organized by the topics that Mary sort of alluded to: healthcare, education, family perspectives, including sexual health resources, and then legal resources, and then systems of care more broadly across the lifespan. So I think that the resource repository is really an excellent example of a lot of collaboration among the experts who contributed to the content of this guide. And we picked, resources that we think will be relevant to Maryland families.
I should say that because I know the question is going to come up, how do we gain access to this guide? And we're going to provide a QR code that will link right to it. And anybody who participates in this webinar will, in a follow-up communication, receive that information as well. So, Mia, you're an educator. As I said, you lead our training administration for the entire institute. That's a lot of trainees. I know you think a lot about what learners need to, the perspective of the learner, not the educator, but the learner. So as this guide was developed, how did you incorporate the audiences that you had in mind, and what voices were included in its creation?
So, as Mary was speaking earlier, we were thinking about the topics that are really coming up on a frequent day-to-day basis during medical visits and some of the consultations with Project Heal. And we were able to leverage the vast experience of the experts that are featured in the videos so that they could really bring to light the important concepts and resources that they have found helpful throughout the whole series. And in particular, we thought it was a high priority to intentionally include the experiences and perspectives of family members throughout the curriculum. We understand that the feeling of isolation is something that many families experience as they address their child's needs. And so, by hearing the voices of others and intentionally including them, we hope to provide that peer perspective to reduce the feeling of feeling alone in the journey um, of taking care of their child.
Next, because each of you has your fingerprints all over this guide, I'd love to hear you comment on what kind of impact you're hoping the guide will have on families and caregivers. And maybe I'll just start out with you, Mia, since you were just commenting, the impact that you were hoping for this guide to have.
Sure. As I mentioned earlier, we really hope this guide will ease the sense of isolation and help families anticipate topics that may come up over time. There are different phases of life, particularly around transitions, whether it's going from the early intervention system to the school system to post-secondary high school. Those transitions in particular can seem very uncertain, and families may find it very helpful to understand what some of the key topics are and the needs are at these different phases. And we hope that knowledge will help promote confidence and provide support. And families can then start preparing for the future stages of development.
Mary, what would you say?
Yeah, I really hope that this, builds understanding about the systems of care so that parents can, as we said, advocate very effectively for their children without the burden of having to look for it, but also to anticipate some of the things that they may not know, I, that they may be experiencing in the near future, or to answer some of the questions that are really hard to ask out loud in the clinic. So I'm hoping that this is that just builds the confidence of the families that are caring for these children.
And Maureen.
Yeah, I would just say, empowering families to be their child's own best advocate, I think is really critically important. And for families to feel like we've heard them, so they come to the Institute, they share their experiences, they talk about challenges that they're experiencing in home, school, and community settings. And we heard you, and we're trying to address it through these video modules. And hopefully you will feel empowered once you go through this curriculum.
So Maureen, one of the necessary steps for this to be impactful is to make sure that the guide gets into the hands of the people who need it. So how can organizations and professionals in all the different spaces where we are clinically, education, advocacy, how do we make sure that the guide reaches the families who need it most?
Yeah, I think to the extent that we can reach out to organizations and professionals working with children with disabilities and their families and ask them to share the link and encourage families to register, this is a free opportunity for learning. And so we want this to be promoted in community providers and pediatricians' offices and everywhere across the state. We also know that local educational agencies or school systems in every jurisdiction in the state of Maryland have a special education citizens advisory committee And most of those committees meet on a monthly basis in all jurisdictions. And so we need to do outreach to ensure that they're sharing the information about the guide and providing families with the links. And then lastly, I think for professionals serving children with disabilities across Maryland, if you're involved in local or statewide coalitions or task forces supporting children and their families, spread the word about the guide. I think, the more conversations we're having about it, the more families that will register and access the content.
Mary, as the chief editor, I know one of the things that you have in mind is how to make sure that the content stays timely, relevant, updated. When you publish a textbook, by the time it's out, it's often old news. So how do you think about the steps necessary for expanding or updating the guide to make sure that it's always timely, relevant, and useful?
This guide, like all of our kind chapters, will go through an annual review just to make sure it'll require continual updating, just to ensure that the information in it reflects the current regulations, the current laws, the current services that are available to children and their families. And that will keep it relevant and accurate. But I think it's also important, we did our level best to, as Maureen said, to listen to families, to listen to what the needs are, and to try to attack those in the first publication. But I think as families access this, what we will need from them is some feedback, right? About the curriculum, to know how to expand it, to include topics that are important to families that may not have been included in the first publication.
Maureen, we've heard mentioned a couple times already tonight the issue of transitioning from childhood into adulthood and how complex and challenging that is as a period of life itself. Can you talk some more about how the guide dives into this area of transition and how the guide can help families with that really complex issue?
Yeah, absolutely. Transition planning is so complex that we included multiple modules on the topic. We have one that dives directly into what's required under the Individuals with Disabilities Education Act. So sort of the nuts and bolts to what IDEA requires for students with disabilities who here in Maryland reach the age of 14, which is when transition planning is required to be included in their IEP or individualized education program. Then we also have another expert who speaks to how transition planning really needs to be implemented in the school and community settings and what are the components of effective transition planning. We go on to tackle some complex service delivery systems, including modules around the Division of Rehabilitative Services, which is a part of the Maryland State Department of Education. And then we also talk about how to determine eligibility, apply for, and successfully qualify for the Developmental Disabilities Administration. So some of these state agencies can be really overwhelming for parents. And so we've dedicated individual modules to each of those. And then I would say that we utilize the expertise of our Kennedy Krieger attorneys to create video modules on adult guardianship and less restrictive alternatives to guardianship, such as advanced directives for mental health, statutory powers of attorney, and then, of course, supported decision-making, which is a relatively new provision in Maryland law. We also included modules around supplemental security income. So as children with disabilities transition into the adult system, we want to make sure that they continue to maintain their eligibility. And then we have a module on Social Security disability insurance, and then one on ABLE accounts, which is an amazing resource for young adults with disabilities in the state of Maryland. So we really have tried to sort of cover the waterfront because we think that all of these issues are critically important for families, particularly when their child with a disability is reaching the age of majority in Maryland, which is 18 years old.
Yeah, I just want to reinforce the one point about SSI and SSDI, really complicated, and providers of care for individuals with disabilities often are naive to the complexities of that as well. This is a resource that is available not only for families, but also for providers to learn more about the complex space that is the care and education of individuals with disabilities. So it's really a broadly available resource. So Mary, how can we build stronger networks of support, both formal and informal for families? The network of support that is so key to the improving the lives of individuals with disabilities.
I see three ways. I think they're like, if Maureen might chime in after me, because I think she's got a whole different network. But from my practice and where I stand, I think the first is what Mia's doing, and that is enhancing the education of our emerging professionals to understand, if not the systems themselves, how to access information about the systems. I think the second is, really being able to continue and maybe even expand what we're doing with Project Echo, this project where we're meeting on a regular basis with an interprofessional team of providers who are stakeholders in children with disabilities. And together we're sort of problem solving tough cases, tough situations, and we're educating each other. ECHO is famously referred to as an all teach, all learn environment. And that is truly what has been happening over the last 10 years. I think we bring education about, evidence-based practice and standards of care. But the community providers tell us really what it's like, in different areas of the states and what's available. And we learn a lot about resources. So I think continuing these collaborations is vital. And the third is encouraging families who are informed or experienced to share their information, their experience, and their resources with other families is really critical.
The point about Project Echo, I just want to underscore this as well. So Maureen mentioned that 108,000 children in the state of Maryland with disabilities, and only 35 attorneys who focus on that space. That kind of shortage is really the case for clinical specialists as well. Neurodevelopmental pediatricians, child neurologists, and other specialists. There just aren't enough of them to take on the full demand of the clinical care that's out there. So this Project Echo is a really powerful way to build capacity so that community providers are able to feel confident and comfortable in their ability to provide evidence-based care out in the community closer to where children live. And so it's a really important part of this process of capacity building. So Mia, turning to you, what role can community members, educators, healthcare providers play in advocating for more inclusive and accessible resources in general?
Well, Brad, healthcare professionals really need to have an awareness and a working knowledge of resources and have an understanding that they need to collaborate effectively with community agencies as well as educators on the child school team. And in addition, healthcare professionals can provide technical assistance, whether it's to help guide an organization or a school system to understand the child's needs. They can also volunteer or share their expertise. And when healthcare professionals make recommendations about different resources, it's really important that they ask for feedback from the families afterwards to find out if those resources that were provided were actually useful and accessible. Because we shouldn't be recommending resources that are not helpful. For the community educators, for the community members and educators, they're able to identify critical needs and support resources that families need to access. Teachers and school teams often know a child very well over a period of many years. So they may have important insights as to what may be needed to help children and families. So, by disseminating knowledge and helping families navigate the different systems that we've been talking about, can be a very important step schools can take to help children and families. Recommending different programs and resources at the right time may be very helpful to families.
Mia, sticking with you and thinking about training that workforce. So there's a need to train more medical providers, not just specialists, but more broadly, as we were talking about, but also providers who are able to take on that transition from childhood to adulthood. Can you talk more about the importance of training future clinical medical providers in this area?
We want future medical professionals to have an understanding of health that goes beyond meeting medical needs. We know that maintaining a healthy life and working towards healthy outcomes includes addressing social drivers of health. And so, understanding advocacy and having that robust Rolodex of resources and understanding of the different processes and transitions children and families need to make is a high critical need in our medical education. So, understanding how families can access these systems, how to navigate are really important steps. And physicians and other health professionals are in a position of responsibility to help families make decisions around how to um, embark upon addressing different systems and providing this information in a timely, effective manner.
So Mary, I think this is actually our last question before we go on to Q&A, but can you tell us how do families get access to this guide?
So it's a free resource. It's on our Kennedy website. It's kennedykrieger.org/kind. But there's also a QR code here on the slide now that is a direct access. My understanding too is that this information will be included in an email that follows our evening session tonight. So we encourage people to come into the curriculum, to share it, and to give us feedback, because the next iteration of this course will be guided largely by the input of the families that are accessing it.
All right, well, now it's time for us to answer questions submitted by our audience members. If you haven't submitted a question yet, or you have some more to enter, please go ahead in that Q&A section of the Zoom, and we can get started. There's a number of questions have come in that have to do with the topic of accessibility, whether it's in, for example, for Spanish-speaking members of the community, or people that have low vision or low hearing. Like what ways has this guide been constructed in order to make sure it's fully accessible? I'll start with you, Mary.
So our learning design team is really conscientious about making sure that all of the slides meet all accessibility standards for their coloring, their font size, everything else. But the other thing that we've done is we've taken the entire narration of every module and put it into text so that it's visible, it's accessible to everybody, and then it can be used with your favorite translator for other languages.
Can you just say another thing? What is learning design technology?
Learning design technology is a team of these really masterful colleagues that we have here at the Institute that take the information that we have, put it into a format that is pleasant to look at, easy to read, and they do a really brilliant job of all the videotaping and editing. They really make the product very professional.
So here's another question that's along the same lines, but it has to do with cultural or social norms, differences that may exist in different communities and their perception of disability, for example. How has the guide or the curriculum taken on recognizing the heterogeneity of cultural differences in the response to disability? Maureen, I can start with you and see if others want to chime in.
I mean, I think first and foremost, we use our experiences in communities across the state to develop the content of each of the modules. So for example, if you're working, and I mentioned it in one of my remarks earlier this evening, but there are certain cultural groups that are fearful of the identification of their child with a disability. And there's a reluctance to go through the infants and toddlers program in certain jurisdictions. And so we take that knowledge and information that we've gained in our own experiences in these communities, and we've applied it to the content of each of the modules so that it's responsive to as many communities as possible's needs. And we sort of walk them through the process, particularly as we're explaining the regulatory components of it. So we want it to be something that's manageable for these families and help them, just empower them to understand what their child's rights are in some of these processes.
Mia or Mary, you want to comment as well?
Sure. I'd like to add and build upon what Maureen was saying around really the fact that these modules reflect the voices of families that come to Kennedy Krieger. And as we created the modules, we thought about the developmental process and the journey that families take as they recognize their child may have they may have concerns about their child, how they can address them, how they can build a supportive team, and the range of experiences families may have upon receiving information, or their experience where perhaps they're looking for answers and it may take some time to get those answers. So by providing the family voice, we're hoping to allow families to feel comfortable with the range of feelings they may be experiencing.
The process question, Mary, one of the audience members is wondering about the ability to connect around making videos, for example, in another location in the country. So if somebody wanted to start that process, creating videos, modules to help educate about, let's say, in this case, it was Washington State, but it really could be generalized to other places in the country. How would you advise them to get started in this sort of endeavor?
I really think that they need to go to the local academic or resource repository in the state where there is this interdisciplinary interaction between medicine and education and law, and recreate. I mean, some of the content that we have is completely relevant across the country. But some of the specifics in education and law, I think, would require the expertise of the disability or special education attorneys within the state, and particularly in the school matters of the school system, because the regulations do change state to state. Even as Maureen was talking about, the transition programs here in Maryland is 14. But federally, I think the requirement is 16. So there are subtleties of change across the state. But I think really what you're looking for is sort of a program like this that has all of the specialists that communicate with each other.
I would
Mia, I think,
also,
go ahead, please. Yep.
thank you. I was also going to suggest using a common repository that exists throughout the country are our LEND programs, which are leadership education and neurodevelopmental and related disabilities, which are a network of training programs providing interdisciplinary training, as well as the University Centers for Excellence in Developmental Disabilities, also known as UCED. So the MCED is Maryland's UCED program, and they also do a lot of dissemination around different types of programs. Will be able to provide expertise around the policies around disability and a lot of the different resources that are available.
Yeah, perhaps in the distribution after this webinar, when we send out to participants, we can include links, including to the AUCD website, which will have information for all those LENS USEDs around the country. So we will provide that as well. So one of a bunch of questions actually around the topic of financial information, financial supports. I think it may link to some of the SSI, SSDI questions, but also other aspects about finances for individuals with disabilities going into adulthood. What kinds of financial, is there information in the guide about financial supports? Maureen, maybe you can take this one.
Yeah, sure, of course. There definitely is. I would direct folks to the SSI and SSDI modules. The ABLE account module is very informative. We also talk about finances in the adult guardianship module and the less restrictive alternatives, where we're talking about powers of attorneys and the implications on finances. So there are a number of places you can look. If you're in the actual guide, it's towards the end. So it's the last set of modules, but we do have a number of different modules that cover all aspects of financial planning for young adults with disabilities and their families.
And in that theme, Maureen, there's a specific question. If we apply SSI or SSDI for our kids when they are teenagers, apply for them when they're teenagers, does it affect their future financially?
So the important part, and this is why I go to the module, but I will tell you the regulations for children is different for adults. And that's something that families usually don't know. And there is a eligibility redetermination when the individual reaches 18. And so just because an individual qualifies as a child under the regulations for children, that does not necessarily mean they're going to qualify as an adult. And so we sort of walk you through that process in the modules. And there are a number of other resources that are linked to that can provide you additional information regarding that. And that's critically important why ABLE accounts are also really important. It kind of goes hand in hand with SSI because the young adult with a disability can save and earn money, and it will be protected and not impact their eligibility for SSI benefits. So ABLE accounts sort of go hand in hand. I would watch that video as well.
So Mary, I think this is for you, but everybody could chime in. One of the questions, actually a couple of questions have come in that link to the concern that there are long wait lists to get in to see us at Kennedy Krieger, and really across the country, long wait lists to get expert services for neurodevelopmental issues. And so Mary, maybe speak to how this approach and Project ECHO, for example, can help provide information in the meantime, but also to build capacity in the community for providers to take on those developmental questions as well.
It's a great question, and unfortunately, it's all too real. There's right now in our country about one developmental pediatrician for every 100,000 children in the country. So our wait lists are long. We're working hard and we're working as fast as we can, but but there's just no. It's a Sisyphean task. We keep working, and the wait lists don't seem to go down. And the whole purpose of Project ECHO and of this project is to bring information to the primary care physicians, to the educators that are caring for these children, to the mental health specialists that are working with these children in community, to try to work with them hand in hand, to guide their practice in the care of children with disabilities so that they are comfortable with their knowledge and their confidence in caring for these children, either long-term, which is the hope, or to be confident in their care of the children until they succeed in getting them in through the wait list. Because without that, there's a big, big, big gap for children and families, not knowing what they're missing, not knowing what they should be doing. And by bringing this information to primary care and community professionals, we're shortening that gap with every echo I think we do, with every professional that joins onto programs like our Echo, and there are echoes across the country that are doing this with the same purpose.
Maureen, I think this set of questions is for you initially. There's a number of questions about the IEP process and the extent to which the guide helps answer questions like, can my child's school change their IEP without my consent? What are my rights if my child's school is not following the IEP? And how do I even initiate an IEP process to begin with? To what extent does the guide help address some of those really fundamental and important questions?
Great, thank you. Yes, we address all of those questions. So I encourage the audience member to access the modules. We have one regarding eligibility for services. We do eligibility and entitlement to help families really navigate those two spaces. We have one module strictly on special education law. We have one module on dispute resolution procedures, which is addressing your question regarding what happens if the school is changing the child's IEP, what are issues around consent, and how can you challenge those issues. So we have broken it down. Again, these are short modules to give you a little bit of really important information in some sort of sound bites that hopefully will stick. And so we further broken special education law down into, as I mentioned earlier, transition planning. We have one on bullying, harassment, intimidation, specifically of students with disabilities. We have one on discipline of students with disabilities. A lot of challenges arise around discipline procedures. So there are a number of different modules that might be helpful for you.
So this is a question I think for, oh, actually, before we go on, Maureen, can you just comment on eligibility versus entitlement? Just make sure we all are on the same page for those terms.
Yes, yes. So when you're identified as a child with a disability, you are entitled to receive services through the local school system. And you can receive those services birth through 21. However, when you exit the school system, and some students with disabilities exit 18, some 19, 20, 21, you're entering in to the world of eligibility. And so the burden is on the individual with the disability, and in some cases with the support of their family members, to apply for and provide documentation of need to receive services and supports either in post-secondary educational programs, employment settings, in community-based services and supports. So it's really a huge shift, and that's something that families really need to prepare for in advance, so that it's not, a phrase that folks often use is like they're falling off a cliff. They go from this supportive, nurturing environment of being in a school and being entitled to services to one where you actually have to prove your need and provide documentation of how your needs can be met and supported in the community.
So Maureen, I think there's a legal theme brewing here. One of the questions that actually multiple questions came in about the milieu that we're in with potential dismantling of the Department of Education and its impact on special education oversight and other ramifications. Could you comment on where we are and what you think the concerns might be in that space?
Yeah, excellent question. We sort of anticipated this one. So I will tell you, one sort of just fundamental thing is, families telling their story and really making sure that their voices are heard and what the impact might be individually on your child and your family if the U.S. Department of Education is dismantled. There are also opportunities to lock arms with statewide and national advocacy organizations who are really going out there and making statements and opposing this dismantling and trying to educate Congress and others on why it's critically important for specifically the Office of Special Education Programs to continue to exist. They have a number of critically important functions across the country, and it's grants management and oversight for all of the spending and ensuring compliance with grants. It's monitoring enforcement of rights under the Individuals with Disabilities Education Act. It's technical assistance and capacity building in states, which is critically important. It's the data collection, reporting, and transparency. So all the local school systems are feeding their data into the State Department of Education and then sharing that with the U.S. Department of Education. And we can look at trends and areas of need. There are specific concerns around legal and regulatory guidance and ensuring compliance and investigation of complaints. And then equity regarding individuals' civil rights and the safeguards that are in place under IDEA if there's no one there to monitor and to ensure that rights are being protected. So we're all concerned, but make your voice heard. And if there's an opportunity for you to engage in effective advocacy with a statewide or national organization, I encourage you to do it.
So Mia, this one's for you, and I think others can chime in, but the question is around whether high schools, the schools themselves, are informed about transition programs. Of course, Maureen, you might comment here as well. But I'm wondering if, Mia, if you could comment on your experience with schools alerting families to the need for transitioning, and then to what extent is in terms of training physicians, to what extent you are preparing those physicians to help families navigate those transitions. How important is it, and what part of the curriculum that we have for training physicians and other providers around transition programs? So high schools and their communication with families around transitions, but also what we're doing to make sure the physicians are aware of the need.
I would say, Brad, that I don't have a strong sense about where high schools are with their knowledge and expertise in this area. I know that educators are very concerned about making sure that to make sure that transition is part of a child's IEP. But in terms of the resources and all the different moving parts, my experience with families in clinic is that it can feel very disjointed on the receiving end for families and patients in terms of different systems to navigate. I think what physicians should be doing, as well as other health professionals, such as therapists, mental health specialists who are working closely with the child and the family, is to help them be prepared for this phase that really involves an assessment of the young person's interests, as well as what their needs might be in community settings. And so it is very much a team sport. And I think the orchestration of that can be very different depending on where it's happening and who's involved. But medical professionals need to take a greater role in guiding families through this particular period of life, because there are lots of very specialized resources. Some of them are very geographically contingent, and it can be hard to access that information. And while physicians may not be the best people to know about it, the people who live in the community have that information. So using the resource finder, talking to school programs and other community agencies is going to be critical. But it is a team sport, and I will say this feels very different from kind of the structured supportive process that people experience in earlier stages of education.
Maureen, you want to comment as well?
No, Mia did a great job. She's good.
All right, thanks. All right. So I think, Mary, this one is for you, and it's a briefly stated question. I think it could be interpreted lots of ways, but what is it necessary or valuable to see, for example, a neurodevelopmental pediatrician or a developmental behavioral pediatrician on a routine basis? Or can that be spaced out over time, or what is the value of that recurrent visit?
So I think that varies with the child and the support, the amount of support that that child needs, and how quickly that child is evolving in either the educational placement or in social settings. But I think that um, what we all do as physicians when we're monitoring children is, and we do some anticipating too about when we see the next life challenge coming, and try to anticipate that by, you don't necessarily need to see us every year, but I know there's going to be a big transition moving into middle school. I know there's going to be a big transition moving into high school, and they're different transitions. But I think for some children, we can space them out if, as long as we're sort of following our own prescriptions about how we need to guide the families for what those families in particular need.
Mary, sticking with you, there's a series of questions that have to do, I think, also with process around the guide. So, for example, the audience member asks, are we allowed to use videos from the guide in trainings or workshops? This audience member is working on a special education workshop series for the families that this member supports. How freely available is this a resource to be used in this way?
We would like it to be used broadly, as widely as possible in this way. I think you'll find when you're in it that you can't modify the videos in any way because they're already cast. But to be able to use them, either giving them to families or sharing them with families while you're with the family or with a training program, is super valuable, because then there's also an opportunity to ask questions and to discuss them as a group. I think it's very valuable to use it that way.
Along those lines, is there a fee for each module for professionals or for anybody?
No fee for any of the Maryland Guide for Families at all.
Yeah, it's a good opportunity to just reinforce how the support that came that made it possible for us to create this, Mary.
Yeah, we're really, really grateful for the help and the support to launch this through the Maryland Behavioral Health Administration, who support us in our Project ECHO and support us in building this guide for families.
Mary, another audience member is interested when they get access to the guide and can review it, is there a portal or a feedback form or a mechanism where we can request or suggest future video topics or additional information?
Absolutely. There's a feedback at the end of the course, and you can skip right to it if you choose to. But it is imperative that we get your feedback, because that will guide future publications of the same material and with additional input from everybody on this call.
This question, I think any one of you or multiple, if you want to respond to, it's a great question. What strategies have you seen or used to make community settings feel truly open, flexible, and warm for families, especially those who have faced barriers to accessing specialty care? I think any one of you could take that on, but Mia, why don't you start with it?
Well, as someone very involved in medical education, I think making sure that all physicians of all specialties, behavioral health professionals, have experience and knowledge about disabilities and what the needs might be in different settings. I think we need to create universal access so that families and individuals with disabilities have their needs met, and they should not necessarily have to advocate for accessible language, learning materials, and accessible buildings. So education of professionals, to me, is an ongoing mission of mine to make healthcare settings more accessible.
Maureen, what would you say?
I would say meeting families where they are. So I have really learned a great deal from going into the communities where the families are and interacting with them in places that they're comfortable. So providing trainings in right in their community, whether it's an hour or 2 hours or 3 hours away from where I live and work. But I really feel like those connections have been really, really beneficial and really helped me learn and understand the everyday challenges that they're experiencing in their own community.
And Mary?
I think I'm going to go back to something Maureen said before, and that is for the families themselves to make their voices heard, because the more they speak, the more we all have to learn and the more we all have to bring and share with each other.
So there's a couple more questions. Maureen, I think this one would be a good one for you. It's really, it relates to gaining access to state level services. For example, accessing doors. Can you go in person, for example, knock on somebody's door and ask for access? How does it work? How do you gain access to these services?
Yeah, so generally not that way. No knocking on the doors, but what you can do. So in Maryland, our Division of Rehabilitative Services is located within our State Department of Education. That's slightly unique. So if there are audience members here from other states, you need to check within your state, because lots of Division of Rehabilitative Services programs are located within the Department of Labor. So it may sit in a different state agency depending upon where you are. One of the issues that we have found here in Maryland is there's somewhat of a disconnect, even though our DOORS program is housed within the same State Department of Education that serves students with disabilities through the Division of Special Education. There isn't a lot of connection between these two divisions. And so we are working really hard in Maryland to really help families connect the dots and help these two different divisions within the state agency work more collaboratively to ensure sort of a smoother process as the individual is applying for services through DOORS. The Developmental Disabilities Administration is another example of another state agency that plays a critical role as children with disabilities are becoming adults and may need to access services and supports. And so in our state, there is an application process, and a critical thing that families can do leading up to the application for services is to have evaluations done, save those evaluations, and provide copies of those evaluations when you're applying for services to ensure that there is no delay and they're not coming back to you asking for more and more information. Provide as much information as you can, but be prepared leading through the transition process to get those evaluations done so that you may be able to more easily access services from DOORS, the Developmental Administration, or any other state agency providing services for adults with you in your state.
Maureen, can you speak to the extent to which this guide will mitigate or eliminate the need for special education advocates who audience member mentions can actually be pricey? Is there a how effective do you think this resource can be to mitigate the need, or will there continue to be the need for this in tandem special education advocates working with this information?
I think it depends on the complexity of the individual case. So, there are cases that if you know your rights and you're simply filing a state complaint and asking for compensatory services, for example, if your child failed to receive speech language services that they're legally entitled to, you most likely would not need an advocate to help you go through that process. We've sort of walked you through those steps. But if it's a complex situation where there's disagreement regarding the placement, sometimes you may continue to need an advocate. But I would say, while advocates are pricey, the more empowered you are, the more that you know, the less that you will need to rely on the advocate or attorney to help you navigate that space. So I think that it can be a great benefit for you to watch the videos, learn more about special education rights, and then navigate to the extent that you can on your own, and then seek help when you actually feel like you've reached an impasse with the school system.
Well, great. So I really appreciate all the wonderful questions from our audience this evening. That's all the time we have this evening. I want to thank our experts, Doctors Mia Sato and Mary Leppert and Maureen Van Stone, and for all of our all of you attending and participating so robustly. We hope you found this Exploring the Brain webinar to be informative and helpful. And as has been mentioned, you'll receive an email from Kennedy Krieger in the next couple of days with a link to access the guide. And we hope that you'll participate in future Exploring the Brain webinars, following Kennedy Krieger on social media, listening in to Your Child's Brain, our monthly podcast that we produce with assistance from WYPR and Baltimore Public Media. You can find that at kennedykrieger.org/YCB on Kennedy Krieger's YouTube channel or wherever you get your podcasts. And for more information about Kennedy Krieger Institute and how you can support our work, please visit our website at kennedykrieger.org. I want to again thank our panelists for sharing their expertise with us this evening. And again, all of you for joining us for Exploring the Brain. Thank you and have a wonderful evening.